I'd like to welcome you here to this forum on post-market evidence sponsored by the Engelberg Center for Healthcare Reform at the Brookings Institution. I'm Mark McClellan. I'm the director of the center, and we're very pleased not only that so many people who know so much and care so much about the safe and effective use of drugs are here, but that you made it through any number of obstacles. I understand there are power outages and traffic blockages this morning, and it's nice to see everyone here despite that. And I think that's an indication of the fact that we are talking about a very timely issue today. The last few years have been marked by heightened public concern about the safety of drugs that are on the market, with some high-profile instances of strong new warnings being added, or even withdrawals of drugs that had been on the market for some years and used by millions of Americans. Steps to learn more effectively about the safety and effectiveness of drugs in actual use has become a top public health concern. And as you know, last year Congress enacted the FDA Amendments Act, which includes some major provisions related to the monitoring and use of drugs after they are on the market. On top of that, FDA has been taking many new steps to enhance its surveillance-related activities. And this conference focuses on some of the most important provisions and issues related to these very important topics. In particular, building on pilot programs and the expanding capabilities of our increasingly electronic healthcare system, Congress called for the establishment of an active surveillance system for drugs and other medical products. This would be established on an aggressive time frame, according to the Congress. The systems of databases for active surveillance is expected to reflect the experience of 25 million Americans by 2010, just a couple of years from now, and at least 100 million Americans by 2012. In addition, the law requires the FDA to seek expert input on a full range of issues related to using this kind of surveillance system, including risk identification and risk assessment, risk communication, as well as risk management steps and risk mitigation steps. With these new authorities, with new funding, with improving electronic data and statistical methods, and with new opportunities for broad-based support for these steps, there is considerable momentum for working together to establish a fundamentally better system for post-market evidence on drugs and other medical products. With the new law and the new opportunities, we may be entering a new era in terms of how drugs are evaluated and how they are used once they are on the market. We're very pleased today to bring together such a diverse and talented set of individuals to address these issues. Representatives from the FDA and from other government agencies, from the academic community, from consumer and patient advocacy organizations, from product developers, from health plans, and from the provider community all join us today. And that's good because there's a lot of work to be done. We'll address a range of issues related to these opportunities for better post-market evidence. We're going to try to do that in the form of a structured discussion with the goal of getting a lot of ideas and issues on the table and providing some opportunities for comments as well, both today and in follow-up to today's sessions. These perspectives will be coming from a broad range of experts. First, we'll hear from the FDA, the Commissioner of Food and Drugs, Andy von Eschenbach, and as well from Deputy Commissioner Janet Woodcock. They'll discuss the FDA's recently announced Sentinel initiative and a number of other issues related to the agency's vision for improving drug post-market surveillance as part of implementing the new law and responding to these new opportunities. Then we'll expand on that discussion, or many of the issues in that discussion, with a presentation from Marcus Wilson and Rich Platt and Janet Marchabroda. They're going to talk about a potential framework for implementing active surveillance using a distributed data network, and about some of the building blocks for this network, building blocks that already exist and in many cases are already being used to develop better evidence on the safety and effectiveness of medical products. As you'll hear, they're working together as part of a broad-based effort, also in collaboration with NGENX, I3 Drug Safety, with the Brookings Institution, and with others, to develop a collaborative framework for implementing active surveillance in the near future. Their presentation will also note how the data and the methods and the best practices for active surveillance are still in development and are still continuing to evolve. While there are new opportunities, there are also some real challenges and obstacles to implementing better post-market systems and using them to achieve significant improvements on our knowledge and use of drugs and other medical products. So after this discussion of basic strategies for active surveillance implementation, We'll then turn to a series of topical panels on key challenges and possible directions for solutions. This includes issues of infrastructure and governance. How can this kind of effort be coordinated, assuring that the best possible evidence on drug safety is developed and drawing on both public and private sources of information and analysis? How can it be sustained, given the limited resources available to the FDA and the need to rely on a broad range of private sector databases and expertise as part of the effort? We'll also talk about data and methods. How can data from a broad range of sources be used effectively for better detection of signals of important safety problems and following up on these signals to determine if they're a real issue? What methodologic issues need to be addressed with such large and diverse sources of data, most of which do not come from randomized studies where the causal effect of the drug can be readily sorted out? And what opportunities exist for learning in new ways, perhaps by applying methods from other complex data systems? We'll then turn to legal and privacy issues. How can all this be done while assuring the privacy and security of patient data and addressing other legal issues related to surveillance analysis? We'll also discuss communication issues and the impact on medical practice of these new developments. How can the results of these analyses be communicated effectively, not just when there are definitive results, that's really the easier case, but also when there are interim findings, when an association between a drug and a safety problem has been identified or is suspected and it's being actively investigated, but the issue hasn't been resolved? How can the effective use of information in medical practice be supported? And are there other key issues from the standpoint of consumers and health professionals that should be addressed? So that's a brief overview of the objectives of this morning's meeting. Now, I'd like to say a few words about how we're going to do it. This is about taking stock of where we are now on these important issues. What key challenges need to be addressed and how can they be addressed effectively? It's not just about answers, it's about discussion, and it's about identifying some promising ways forward with the challenges we still face. In setting up the conference, therefore, we had several principles in mind. One was that a broad-based approach with presentations from a diverse set of perspectives was the best way to facilitate the discussion and facilitate moving forward. We do want to share some collaborative works that has been ongoing, that we've been involved with on these issues, but we mainly want to stimulate ideas that can be the basis for broad-based support and timely implementation in support of the FDA's mission. Another goal was that we want discussion, not canned presentations of talking points. And in addition to asking presenters to identify key issues and be part of this discussion, we want input from all of you who are here today. We'll have roaming microphones in the audience, and we hope that many of you will use them for questions and comments as the day progresses. By the end of the session, we'd like to identify some next steps for our own collaborative work and that of others to support this critical and urgent part of the FDA's mission as effectively as possible. We expect this to include some papers reflecting today's discussion, as well as other steps to support the implementation of a fundamentally enhanced system of post-market evidence as quickly as possible. And just a few other housekeeping notes before we get started. This event is being webcast live and will be archived on the Brookings website for future viewing. We have a number of press in attendance with us today, and I'd like to thank you all for joining us. And because we've got a lot to get through, I'd like to remind our presenters to keep their remarks as brief as possible in order to allow ample time for discussion. So this doesn't apply to you guys right at the beginning, but for most of the presentations, we're going to be aiming for about 5 minutes or so of remarks so that we have enough time for open discussions and questions. Also, for all of you, all of the slides being presented today, all of the other conference materials will be posted on the Brookings website at brookings.edu as part of the Engelberg Center for Healthcare Reform's web presence. So in advance, I want to thank you all for contributing to this important and timely meeting.